The next presenter is a really also a phenomenal woman. This one is a Jamaican woman. Before I say that, I'd like to say that the lady that you talked about, Dr. Burke Harris, she's the daughter of a Jamaican professor of science here who went to school with me here and who was in Taylor Hall with me. You all know Mella Burke? That's his daughter. Dr. Burke works with in the university campus here somewhere. He used to be a chemist. Now he's involved in behavioral stuff. That's his daughter. She's a Jamaican woman.
It makes sense now.
Of course it makes sense. Makes sense.
I understand now. I did not know.
Now you know.
Now I know.
And all these things are coming out of Jamaica. What can I tell you? The next person you're going to hear from is another phenomenal woman. She is Maureen Samms-Vaughan, who is from the University of the West Indies here. She's the professor of pediatric psychiatry here and pediatric mental health, whatever the title is. But the importance is that she's a pediatrician who has been trained in psychiatric issues, and therefore the importance of her work now is that I really want you to get it clear. She is focusing on the first 3 years of life. In other words, we are saying in Jamaica that in terms of the primary prevention, if we don't start from in the womb, then we're not going to solve this problem. So in other words, I'm really welcoming Professor Maureen Samms-Vaughan to be able to speak to you on this topic. Welcome, Maureen. Known her a long time too, and
Don't tell them how long, Freddie. Don't tell them. Okay, it's really great to be here with you all today. Last year, I spoke about the first 1,000 days of life, and I'm pleased to let you know I'm working with the Minister of Education to develop a national program for the first 1,000 days. But we're still working on that, and we're going to get that done. Today, I'm going to be speaking a little bit more broadly on maternal and child mental health challenges in Jamaica. And when Dr. Burke Harris came here to speak, I was ill at the time, but somebody presented my data there to show the data that we had here about adverse childhood experiences and the impact. So I'm really going to be presenting the data from 2 longitudinal studies. And this first slide is really very important. The majority of medical research is conducted in high-income countries, even for conditions for which prevalence is greater in lower and middle-income countries. And Manuel Eisner researched and published a very important paper that shows that more than 95% of publications on interventions to reduce violence relate to 12% of the world population. So all of them done in high-income countries. And we know that the violence, though other countries are not immune to violence against children, but certainly countries where there are higher levels is where we have the least information. Luckily, we have a rich history of original research at the UWI, and today I'm going to focus on maternal and child mental health. So I'm going to talk about 2 longitudinal studies from which we obtained that information, and I'm going to look at just selected life events today: parenting and family functioning, social environment, risky behavior, and exposure to violence. So just to give a little background to the 2 studies, the Jamaican birth cohort studies started in 1986. They were patterned off the British birth cohort studies. The British were the first people to do birth cohort studies. They started in the 1940s, and they're now studying the children of the children of the children. And the information was so fantastic that other countries across the world did this. The first birth cohort study in Jamaica, we looked at 10,000 mothers and babies born in September and October 1986. Initially, the study was designed to look at maternal health and newborn health and well-being. But as with in Britain, we then took these studies further. We followed the children at 6 weeks, and then we next saw them at 11 to 12 years, and then again at 15 to 16 years. And the aim of those studies was to look at factors associated with health, development, and behavioral outcomes. So in those older kids, we just went through all the school records and we just picked out all the kids born September and October 1986, a really good way to do a study. We saw 1,720 11 to 12-year-olds, and we saw 1,565 15 to 16-year-olds, and they were old enough for the young people to complete questionnaires for the parents and the teachers, and we also evaluated the children's academic outcomes. The second study is the Profiles Project. This was a nationally representative sample of children in their last term of preschool, 5 to 6 years. They were identified from the Jamaica Labour Force Survey, which takes a national population sample of 0.5% of 7,648 households. So we ended up with approximately 255 to 6-year-old children, and we followed those children. And these were some of the things that we looked at. I have 2 girls there, no boys, and I'm going to speak specially about boys. So let's talk about what we found, and I'm going to be talking about all the studies, the 6-year-olds, 11 to 12, and the 15 to 16. So I'm just going to be giving a general overview. So let's look at parenting first. At 6 years, the typical 2-parent family is not a majority for our children. There are only 40% of children who were living in families that had 2 parents. Parenting from a distance is a reality for Jamaican children, particularly for fathers. And the parenting from a distance was due to the absence of a relationship. They've never lived together, both parents. Then early relationship failure, and then migration, both internal and external migration. Parenting from a distance for mothers was much, much less common, about 5 to 10% of children. And the reason for this was migration, or the child being taken away by the grandmother or the aunt or somebody else who felt that the mother was not a good enough parent. Or sometimes the first child is given to somebody to grow. When we evaluated the family functioning using traditional family functioning measures in the US, we found that the Jamaican families were actually functioning fairly well in terms of those measures of family function. But when we used a measure of parental stress, the Parental Stress Index, actually what happened was that when I did the Parental Stress Index and I saw the high levels of parental stress, I said, my gosh, I've done something wrong in the calculation. I need to go and check it out. And I went back into the data, couldn't find any errors. And then I looked for the Parental Stress Index figures. For the only figures that I found, I didn't find for African Americans, but I found for Americans of Latin American descent. And they were almost exactly the same. And I felt, okay then, I didn't make any errors because, Latin America, a lot of the things that we do are actually quite similar. And they had extremely high levels. And when we looked at what were the factors that were causing parents to be stressed, and the parental stress levels were much higher than the other stressors, new job, even poverty, the parental stress levels were really high. The parents said that they didn't find their children acceptable. Their children remember these children are 6, okay? They haven't reached adolescence yet, when we all don't find them so acceptable at that point. But anyway, at 6 years, these kids are little kids. The parents didn't find that they were acceptable. They found that the children were too demanding. 6. They found that they didn't have adequate attachment to their children. They didn't feel connected enough to their children. But the good thing was that they were recognizing that they were not competent enough to care for their children. They felt that they didn't know what to do. Some of the questions were like, they didn't realize parenting was going to be so hard. They didn't realize parenting was going to take up so much of their time. This tells us a lot about how parents feel about children and how parents understand what their parenting role is. Then we looked at what happens to children in Jamaica in terms of their parenting structure. So we have the 6-year-olds, the 12-year-olds, and the 16-year-olds. I took a little bit of statistical license here. And at birth, we see that about 15% of children are born into married unions. Vast majority are born into visiting unions, 50%, and another 35% or so are born into common law unions. I want you to see what happens to the common law unions. They fall slowly to about 10% by the time the children are 16 years old. The visiting unions fall far more rapidly. By 6, most of them are gone. The marriages increase up to about 25 to 27%, but they stay right there. They never get any further. And remember, this is the relationship between the biological parents. Sometimes the parents marry other persons who are not the biological parents. This is a relationship between children, between the biological parents. So we have children in Jamaica who are constantly moving through these changing family structures. They have to adjust and adapt to the family structures as they change. Let's now look at how the kids feel, how they feel connected. And these are the 16-year-olds. And we ask the 16-year-olds, who do they feel closest to? Who is the person they would share their challenges with? And you can see the mother. This has to do with the matriarchal society that we have, most children living and connected to their mothers. And right behind that is their siblings. Then the boyfriend or the girlfriend. I want you to see how high that ranks their partners. And then their friends. See the friends ranking very highly. And you see that the friends and the father are ranking together. All right? And then the teacher is way down. Okay? So they don't feel at all connected to their teachers in the school settings. So here we look at what are the kind of support systems that our children are actually using. This is a little bit of a complex slide. Oops, sorry. And this just is showing how the family structure impacts children's school achievement. So the children who live with the biological father, one being the base, and this is a regression analysis. The children who lived with the biological fathers had the base figures there, 1.35 for reading, 1.61 for spelling, 1.17 times for arithmetic. When they lived with the biological mother alone, they were likely to have higher reading scores, higher spelling scores, and higher arithmetic scores. When they live with just a single parent, because you can imagine how the stresses, how much more stressed raising a child as a single parent is, their spelling scores diminished. There was no difference in the reading and the arithmetic scores. But when they lived with two parents, their reading and spelling scores were considerably higher. Their arithmetic scores were just the same as living with the biological mother. It says that mothers don't know too much about math, huh? Anyway. So we see how the family structure impacts children's learning. Let's take a little look now about the social environment in which our children are living and growing. Most Jamaican children watch television, 80% of them, regularly that is. Most attended church regularly, 75%. Remember, there are 6. Many, 50%, were in supervised leisure activities, you know, the little groups at church, the little groups at school. Look at reading. Few read books consistently. 50% of children looked at or read 1 to 2 books per month, and primarily those of the higher socioeconomic groups. Leisure activities and chores were gender determined at a very early age. Chores were more common among girls and among lower social class children. So in terms of the gender questions that was asked earlier, we see that we're very gender defined as a society. Harsh discipline was common, and that ran across all social class groups. In the Caribbean, we really, really enjoy hitting children. Parents spend very little time in activities with their children. Remember, again, these are 6-year-olds. Now we look at what happens over time with leisure reading. And the light blue is boys, and the dark blue is purple. The purple, dark blue is purple, wow. The purple is girls. And we see that at 6 years, girls are already doing more reading than boys. But we see that at 12 years, that gap widens. And we see that at 16 years, that gap widens even further. Only a half of boys are reading. 3/4 of girls are reading. So you see the boys just falling away in terms of reading as time goes on. Let's look at what happens with church attendance. Boys and girls are attending church about the same at 6 years. By 12 years, the girls are still there. The boys are beginning to fall off. By 16 years, they're both fallen off a bit, but the boys have fallen off more than the girls. Let's look at organized activities, and somebody tried to confuse us this time because the blue is girls and the yellow is boys this time. And at 12 years, the girls are in more organized activities than the boys. And again, at 16 years, more girls are in organized activities. Interestingly, a greater proportion of boys are in organized activities, but you see the difference between the boys and the girls. And when we did this analysis of what happens with reading and spelling scores, we saw that church attendance, as you increased the number of activities, as you increase the frequency of activities, so frequency of church attendance, frequency of books being read, frequency of attendance to leisure activities, you saw that the children's academic scores improved, but as they watched television, you saw that the scores diminished the more they watched television. And we know that greater than 20 hours of television per week. And now it's not, when I was doing the study, it was television. Now it's screen time. So it has to do with not just TV, but anything related to a screen. All right, now let's look a little bit about risky behavior and exposure to violence. We asked parents, the child behavior checklist was used for these, and so the children are old enough at 12 to complete the self-report. Their parents completed and their teachers completed. So almost 13% of children at 12 years reported that they were using drugs and or alcohol. At 16, this had gone up to 37%. What is important here is that the parents really don't know what's going on. Teachers even worse. Because these were, the children were self-reporting. They were remarkably, very honest in their reports. We had to convince them that this was going to be confidential. And, they came to ask questions about how to complete the forms in terms of what they wanted to ensure was there. So a lot of our kids getting into drugs and alcohol without adults being fully aware. Similar thing for suicidal ideation. These children, almost 14% reported suicidal ideation at 12 years, and a similar proportion at 16 years. And again, parents are largely unaware of what's happening, and teachers even less so. Now we talk about exposure to violence. And in this slide, we looked at children at 6, 12, and 16 years, their exposure to community violence as witnesses. And we see that the 6-year-olds, were not reporting for themselves for this, the 6-year-olds were reporting using a very simple instrument. The 12 and 16-year-olds were reporting using a much more complex instrument, and we see how that changes along. So about 70% of 6-year-olds said they had seen people fighting each other in the streets. More than 80% of 12 and 16-year-olds did. Between 25 and just over 40% of children reported stabbing, shooting. 20% reported witnessing shooting in their communities. And the last one is having seen a dead body where the death was not due to illness or injury. Okay. And we see that up to 60% of 16-year-olds reported that they had viewed a body usually as a result of a violent death. These are children in Kingston and St. Andrew. Let me just clarify. It is not rural children, KSA, so that would be higher than we would expect for the entire country, because the rural population would probably have a little less. And this was their exposure as victims, whether they had ever been beaten up. Close to a third of children, 6-year-olds, reported that they had been beaten up, a similar proportion at 12. And I guess when you get to 16, you're not so easily beaten up because you can fight back. So that drops to about 15%. And you see the same thing happens with robbing and stabbing and being shot at. All right? It's low, but it's still a significant proportion of our kids reporting being shot at. And then you see what happens with victims of sexual abuse. That's where you begin to see the rise in the older adolescent. Exposure to corporal punishment, the H is home and the S is school, on the x-axis there. Minor is minor events. It's easier to say what the severe. The severe event is hitting with an implement. The minor is shouting at, throwing things at, but not hitting with an implement. So the minor exposure to corporal punishment, 30% of 6-year-olds reported this. The 12-year-olds were almost everybody. And again, at 16, you tend not to hit 16-year-olds as much because they'll hit you back. And for school, we did not have the reports from the 6-year-olds at school, but you see that at 12 years, there's quite significant corporal punishment still being used in schools. But please note the corporal punishment in schools is lower than that in homes. And these are the proportion of kids who witnessed intimate partner violence. 30% of 6-year-olds reported seeing adults in their home hit each other. A greater proportion of 12 and 16-year-olds did. Sorry, that's for verbal abuse. And minor and severe witnessing of intimate partner violence. And what happens to the 16-year-olds is that they're probably not at home enough, so they don't see as much of the abuse as the others. In terms of forced sexual activity, 3.6% of 16-year-olds reported, 1.6% of males, and 5.3% of females. But I want you to note that although these 16-year-olds were witnessing intimate partner violence in their homes, they were also already becoming victims at 16 years. So there was verbal aggression in their relationships. Up to half of 16-year-olds were already in a verbally aggressive relationship. Minor violence, 4.1%, and severe violence, 1%. So some children were already being beaten by their partners at 16. We mentioned in multiple exposures to violence. One of the terms that's used for this is polyvictimization. And when we looked at corporal punishment at home, corporal punishment at school, exposure to community violence, and exposure to intimate partner violence, these were both witnessing and being victims of community violence. These were the 5 that we ended up with. And what you can see there is that very few Jamaican children have absolutely no exposure to violence. And the majority of children are experiencing 2, 3, and 4 forms of violence. When we compare this to polyvictimization around the world, surprise, surprise, we're smack on with South Africa. But the USA and Canada are there just to show that high-income countries are not immune. Their levels are lower, but they're certainly not immune. We also know that when children get exposed to violence, we have biological changes that are taking place. At 11 to 12 years, we measured cortisol levels, which shows the impact of violence on stress. And we did this for a number of individual violence measures, and it showed that the children who had reports of being stabbed, suggesting coming from violent communities or violent homes, when they got to school, their cortisol levels were considerably higher than the children who had not had this experience. It eventually settled by 3 hours, but you can imagine that for those first 3 hours, those children can't learn as well. We also looked at the factors that were associated with aggression, and one of the first risk factors there is greater than 3 mother figures. Remember, I mentioned to you about how much children shift and change. Family functioning. And 1, 2, 3, 4 of those factors are exposure to violence. So 4 of 10 factors there that are related to aggression in our children are exposure to violence. I just put this up to show you that we really did some complex analysis, structural equational modeling, but I'm going to break it down to this. All right, that's the same thing, just broken down. So polyvictimization impacts children's IQ. So children's cognition, thinking, reasoning is impacted directly by polyvictimization. And that IQ then impacts their behavior. That IQ impacts their school achievement. There's no direct relationship between polyvictimization and school achievement, and there's the only direct association between polyvictimization and behavior is for boys, or vulnerable population here, boys. What is important to note is the fact that it doesn't go straight across from polyvictimization to achievement and moves through IQ means that we really require cognitive behavior therapy for these kids. Cognitive behavior therapy is not available to the majority of Jamaican children. We can't continue to have our children exposed to violence that needs a treatment that we cannot afford and do not have available. So clearly, our plan must be for prevention. So in summary, parenting structure changes frequently for children. They often do not live with both biological parents. Those who do better at school. Attending supervised activities, reading, and attending church are associated with better child outcomes, while television viewing is not. Jamaican children have high levels of exposure to violence. As they prepare to leave childhood, they now move into intimate partner violence, and the cumulative effect of their exposure to violence has devastating impact on their learning and behavior, and the biological markers confirm the impact of violence. Boys become disengaged from the protective factors of organized activities, church, and reading over time. They also become disengaged from school over time, as measured by academic scores, despite having similar potential to girls. I didn't show this data. Their disengagement is accompanied by high rates of corporal punishment, so we feel that we can beat these things out of them. It doesn't work. The findings from just the policy implications, the findings from the parenting research were used to guide the development of Jamaica's national parenting policy and to guide public education programs on parenting. We really have to get more leisure activities going. The kind of activities that CARIMENSA is doing, as well as other activities, some you mentioned, Dr. Stewart. The need for public education on the impact of violence on children and the development of violence reduction strategies. Boys are especially vulnerable and require specific strategies for engagement and support. The 1986 birth cohort was most recently seen at 19 to 20 years and assessed for early markers of chronic disease and mental health. Analysis of childhood events and adult outcomes will follow. We started a new birth cohort in 2011, all kids born July to September 2011. At our JA Kids, that's what our kids are called, at our JA Kids conference, we will be reporting on parental depression, father's depression, mother's depression, impact on these children. That conference takes place March 30th to June 1, and we'll be reporting on the first 1,000 days of life and the first 5 years of life. Thank you all for listening.
Wonderful, huh? Really fantastic. In other words, and all I can say is that in Jamaica, we've done the work and we have the data. So the reality is that we will change the world. So we're going to have one question because we're running out of time, or we're trying to keep on a time mark. That lady?
Thank you very much, Dr. Samms-Vaughan. Interesting, fascinating, scary. My question, does the data provide us with any information about the ages of parents? I just feel as if parents are getting younger and younger last 10 years. And I just wonder if the age of the parents is any, is that significant?
We haven't seen any significant change in the age of parents because the two studies, 1986 and 2011, are 25 years apart, and we really haven't seen that. But one of the things that has happened in the time between those two studies is that we never, this is a little deviation from your question, is that in 1986, nobody talked to fathers. Nobody paid them any attention. We didn't. It wasn't a big deal at that point. We just talked to mothers. And one of the things that we do have in the 2011 study is data on fathers, hearing fathers' voices, and listening to fathers' perceptions of their parenting. So the answer to your question is no, we haven't seen that, but we hope to report more on fathers and on younger children in the immediate future.
Thank you so much.
Okay.
Let's hear it for her, please.